folks, I am Stephanie Fish with the Norton Sports Health Kentucky Derby Festival Mini and Marathon Training Program for 2022. I am super excited to announce that we are back in person, updated and improved, and ready to run this year.
Yes!
As your training program coordinator, I want to first say thank you so much for continuing to choose Norton Sports Health as your training coach, whether it's in person or virtual. Secondly, we have some awesome opportunities this year in 22 to help keep you on track in your mini and marathon training. In-person Saturday morning group runs will be a great key in keeping yourself accountable for those long runs. Virtual noon Tuesday talks every other week will give you some great information from special guests such as Norton providers, court physical therapists, and more. And in-person Tuesday evening hill, track, and yoga sessions will work on your strength and flexibility. There are so many great things happening for this training program. You might ask yourself, how do I stay informed of all this stuff? Well, let me tell you. Text alerts. Text alerts are a great way to stay informed. Sign up by texting Norton Run to 37492. You will receive reminders on weekly run locations, a Map My Run link for the Saturday routes, and more. Facebook group. NortonTrainingTips.com is where the Facebook group is, but this is a public web page where you don't necessarily need to have a Facebook account to view it. This is also a great place to stay informed for weekly runs, routes, training tips, and motivation from your fellow trainees. Weekly emails from Norton Sports Health. Make sure you officially register for the training program at kdf.org so you will receive the weekly tips and information over our 15 weeks leading up to race day. And the training manual. If you are old school like me, you can always refer to the official 2022 training manual for all of the information. What's that? How do you get this amazing training manual and this fantastic tech shirt? If you were one of the first 800 folks to sign up for the training program, you get this shirt. And everyone receives the official training manual at the kickoff tonight, as well as Norton Sports headband, gloves, and a mask. I'll give you a few more details in the kickoff a bit later in this program. In the meantime, let's have some VIPs offer you some tips as you prepare your training journey with Norton Sports Health.
I'm Dr. Ryan Krupp, Medical Director of Norton Sports Health. I'm excited that this year, the Norton Sports Health training program will be held in person. I want to thank each of you for your participation. Whether you're a beginner or veteran racer, this training program will help you reach your full potential. As one of the Louisville area's leading sports-related injury prevention and treatment programs, Norton Sports Health provides advanced care for athletes and active individuals of all ages, regardless of your fitness level. Our specialists are experts in surgical and non-surgical treatments and rehabilitation for all types of sports-related injuries. In addition to caring for sports injuries, the specialists at Norton Sports Health are involved in research to gain a better understanding of why athletes become injured, with a team that includes fellowship-trained orthopedic surgeons, non-surgical orthopedic specialists, neurologists, a sports psychologist, nutritionist, and athletic trainers. We are uniquely qualified to guide you in your journey to prepare for this race and those in the future. Good luck and good training.
So my name is Robin Curry. I'm a sports medicine physician with Norton Orthopedic Specialist in St. Matthews. I'm also the co-medical director for the Kentucky Derby Festival Marathon and Mini Marathon. So we're excited again to be a part of the training program and to provide medical coverage on race day. Prior to starting the training program, then you should take a look at your overall general health. So there are some questions that you should maybe ask yourself before you start the program. Am I healthy enough to start? Am I healthy enough to start this program in general? Healthcare professionals used to always recommend that you see your healthcare provider, your primary care provider, before you started any sort of new exercise regimen. But the American College of Sports Medicine wanted to try to maybe eliminate some of the barriers to initiating exercise. So they actually helped develop some questions that you could maybe ask yourself before you started any sort of new exercise plan. So there's 3 questions. The first question is, how active am I? So are you exercising 30 minutes a day for 3 days a week for the last 3 months? So if you're already doing that and that's already part of your routine, it's probably safe to go ahead and continue on with our training program. But if you're more of a sedentary person, then you'd want to maybe go in and check with your primary care provider and get their okay before you start. The second question is, do you have any comorbidities or chronic medical conditions? So that would include heart disease, kidney disease, diabetes. If you have those conditions and you haven't seen your healthcare provider recently, then you want to go ahead and check in with them and make sure that they give you the okay. If you don't have those medical conditions, but you have some symptoms, then these symptoms would warrant an evaluation. So if you have any chest pain, shortness of breath, lightheadedness, dizziness, those things would be something that you'd want to look into and make sure that it's not a sign of some sort of underlying condition. And the last question is, how intense is the exercise that you want to participate in? So if you're going from being sedentary to wanting to run a full marathon or running a half marathon, then probably ought to go ahead and get your doctor's permission before you do that. If you're already somewhat active and you're just planning to walk, or you plan to walk run, then you're probably okay to move forward with that as well. So you can use these questions to help determine which path you should follow moving forward. So are you okay to go ahead and use the training program, or go ahead and check in with your doctor first before it's safe to do so? It's also a good time to maybe think about getting that yearly physical. So if you haven't had your physical in the last year, go ahead and do that now. Get it kind of a tune-up. Also have them maybe check some lab work and make sure that everything checks out okay before you do this program. And lastly, I'll say if you have any orthopedic issues, so any sort of muscle pain, bone pain, joint pain that either you haven't have evaluated or that you haven't seen any improvement in despite maybe the treatment that you've received, then it's probably a good idea to go ahead and check in with either your primary care provider, or you can check in with one of us in the office, and we're happy to see you for that as well. So you can use these questions if you want to go to the American College of Sports Medicine's website. They have a questionnaire that's called a PARQ, or a physical activity readiness questionnaire, and it'll lay out all of these questions that I've already mentioned and help you decide which way you should move forward, whether it's okay to go ahead and start the program or whether you should check in with that primary care provider before doing so. So our goal is to get you from the beginning of the training program all the way to the finish line, and to do so in a healthy way. And so we wish you the best and hope for a really safe and healthy training season.
Hi, I'm Elliot Mattingly. I'm a physical therapist with Court Physical Therapy, and we are now on our 3rd year of participating with the Norton Sports Health Training Program for the Kentucky Derby Festival Marathon and Mini Marathon. We're so excited to be back, and really we're trying to create a bigger role for us. That way we can serve you as our runners and help you get across the finish line. So what I want to do today is just talk a little bit about what to expect from us as physical therapists and help you along this training program, once again, to get you across the finish line. You're going to hear me say that a few times because that's the ultimate goal of us in our relationship with Norton Sports Health and you as the runner. So what you're going to expect is you're going to have about 2 or 3 of our physical therapists or occupational therapists or athletic trainers out at the races, out at the runs, any of the training events that you have, you're going to see us there. We're going to be there with our bright green shirts on that say Court Physical Therapy. Stephanie's going to introduce us, and a lot of us are actually going to go run with you. And I'll be there running with you as many times as I can because I love this event. I love the training program and just the different people that brings together. It's one of my favorite things to do. So look for us, but you have to utilize us. Ask us questions. We are there to serve you as the runner to help you get, once again, across the finish line. So what you're going to see is at the beginning, we're going to take you through some stretches, some warm-up activities. We're going to go off with this run with you. That's a perfect time to ask us questions. People think they need to start talking to PTs after they're hurt. Sometimes you can figure out what to do before so you don't get hurt. But if you do end up getting hurt, call us as soon as possible. The reason why people don't go see PT as a runner is they think that we're going to make you stop running. That is not our goal. Our goal is to keep you running and keep you a part of this training program the best we can. We're going to do different things like dry needling. We're going to do gait analysis. We're going to do running specific exercises to make sure we can keep you running and keep you moving. We'll look at the training program. We're going to come up with strategies on how you can maintain your mileage, your time, or whatever it is to help you reach your goals. But we can only do that if you reach out to us. So we're there. We are a service to you. So when you come through and you call us for physical therapy, you have to let them know that you're a part of the Norton Sports Health Training Program. We're going to get you in as soon as possible. We want to get you in within 24 hours. And the reason for that speed is because the faster we get you into therapy, the faster we get you back out, and the better off you're going to be to help finish your program. When we talk about gait analysis and dry needling, all these different things, these are options for us. That doesn't mean you have to do this stuff. Our goal, once again, is to give you the tools that you need to get where, to be successful and to finish your runs. So use your PTs, use us at Court Physical Therapy. Let us know you're a part of the training program. I'm going to be accessible through many different avenues this year. Come see us at the Kickoff event. Whatever you need from us, we're here to get you across that finish line and help us celebrate at the end of the Derby Festival Marathon and Mini Marathon. So reach out if you need anything. I'll see you soon.
Welcome to the GE Appliances Kentucky Derby Festival Mini Marathon and Marathon Training Program, brought to you by Norton Sports Health. Dr. Ryan Modlinski, I'm a sports medicine specialist at Norton Orthopedic Institute, and we're so glad to have you with us today as this is our annual kickoff to the Kentucky Derby Training Program. I want to give you a little bit of information about ourselves and what our services we can provide so we can make this an enjoyable experience for you in terms of your marathon experience and your half marathon experience going forward. We specialize in treating runners and athletes of all ages, so whether you're a novice or a professional and this is your 20th marathon, we certainly have the ways and tools to kind of help you get through this as symptom-free as possible. One of the more common things we see usually with a lot of our novice runners or even some more experienced runners is a condition called runner's knee. So how do we know if we have runner's knee, and what is runner's knee, and how do we differentiate it from something a little bit more seriously? Well, runner's knee is typically more that anterior naggy pain that you get in the front part of your knee, sometimes associated with some grinding or, as we say, crepitus, sometimes pain worse with squatting or kneeling, and may or may not be swollen. How do we differentiate that from something more significant? Well, sometimes, if the pain is increasing or if we're getting more significant, that's something that we can help and look at some of the big risk factors that kind of help contribute to runner's knee. Some of those things are kind of weak muscles around the hip, some of the tight musculature in your hamstrings or calf. Sometimes it can be some of your footwear or foot choices or running shoe choices. And sometimes it can be kind of how well you train leading up to the mini marathon program or how fast you accelerate during the program. Some of it can be things you do during your training program, including adequate titration or sort of moving up your training program appropriately based on how you're responding and how you're feeling. Dynamic warm-ups or sort of warm-up before you get out ready to run. And some of it can be making sure that you recover well and hydrate during this. Even though it's winter, you still need to make sure we adequately hydrate during the course of this running program. If you've had a previous injury in years past, that's a big risk factor. So we certainly want to get ahead with you and kind of get you in the office, talk to you, and kind of see if we can't figure out what other contributions are contributing to some of your other previous injuries, because that's a big risk factor for further injuries leading forward. So if you're having any problems with runner's knee or any other running problems or ailments that kind of bothering you, please feel free to reach out to us for an appointment with one of our sports medicine specialists, and we'd be more than happy to help you. So hope this helps get you started on the right track, and we look forward to seeing you out there during the training program, and good luck with your running.
Hi there, my name is Dr. Jeff Stevenson with Norton Sports Health. Happy to be a part of the KDF Mini Marathon Training Program through Norton Sports Health again this year. Was given a few minutes just to talk about some of our running overuse injuries. It's always something we struggle with and deal with as we go through the training. So I wanted to talk a little bit about what to look for and some of the most common injuries. First off, we talk primarily about bone injury. We're putting a lot of stress on our bones as we're running, especially our lower extremities. Some of our common injuries involve stress fractures or even their precursor, which is a stress reaction. So that really is inflammation in the bone. And if we get enough inflammation in the bone, then that bone can weaken to the point that we have these fractures that occur. Some of the most common areas where we see these stress fractures are the metatarsal bones, which are the main foot bones in the middle of the foot. We see it at the knee level with our tibia bone, as well as the tibia at the tibia plateau, and then we see it in the actual bone of the shin, which is the tibia. So pay attention to areas like that where you may have pain. Some of the things that we look for are focal soreness and tenderness. It hurts when I push on a specific spot along the bone itself. If it's something that we have pain there, and this pain is not only when we're working out, running, but also when we start to walk and we have pain
outside of exercise, it's definitely more concerning, and it may be time to consult myself or one of our other physicians regarding this pain that you're feeling with training. One thing that we really think about, if the pain is worsening the more and more that you run, and it gets to a point that you have to stop running because of the pain that you're feeling in a specific area in our lower extremity, definitely something that we want to pay attention to. Some other areas of injury involve some of the soft tissues of our lower extremities, and that involves tendinitis, or a condition called tendinosis, which is degenerative changes to the tendons around our joints. Some of the most common areas, of course, are the Achilles tendon, which is the big tendon in the back of your heel that comes from the calf muscle and attaches at the base of the foot. We also see this in another tendon in the foot on the outside of the foot and ankle called the peroneal tendon. And then we see tendinitis or degenerative changes around the knee at the patella tendon or the quadricep tendon. And then one other one that we think about too is the IT band. We can have problems with the IT band, which is another soft tissue connective structure that runs from the hip all the way down to the outside of the knee. Once again, warning signs involve pain when we start up our activity. A lot of times they can get a little better as we're training and as we're being active, but then once we stop, they get really, really painful and can lead to pain with walking. So once again, pain is a big indication here. If you're continuing to have pain with exercise, but also it worsens afterwards, after you stop, it definitely is something that we want to pay attention to. General treatment involves resting, ice, sometimes anti-inflammatories can be used, so some of the over-the-counters like ibuprofen or Aleve can be used in the short term. If pain persists and it's not improving and it really starts to limit your ability to be active, once again, that's a reason that we want to seek medical attention. In summary, we can all have aches and pains when we're running and training and doing new things as far as our activity goes. As we build and build and build, our goal is to do that gradually with our correct progression. Sometimes it's too much for the body and we have to take rest periods. If it's something that really starts to limit your function throughout the day, or you start to have pain outside of exercise, I would contact one of our sports health physicians and see if we can get you treated so we can get you back and not miss too much time or have too much of a worsening problem.
Hello, my name is Chris Boyd, and I am a registered dietitian as well as a certified personal trainer. I am an avid runner as well, and so today I want to talk to you just a couple of brief and general topics in regards to running as well as dietetics and nutrition. The first topic I want to touch upon is the amount and type of calories you need as you start to train. I don't recommend initially to increase your caloric intake or your energy intake, as we call it. I also don't recommend that you reduce your calories at first to try to increase your ability to reduce weight. That sometimes in a lot of opportunities will have a negative effect. I will say that as your training increases, you will likely need to increase your calories. I would listen to your body. I would start out with 1 to 2 snacks per day, spaced throughout the day, of anywhere between 250 to 350 calories per snack. You will see as you start to peak your training, the likelihood for you to need to increase your calories to even a 4th meal on top of those 2 snacks per day. And that's perfectly understanding with the amount of calories that you're burning. So while there is no hard and fast rule in regards to the amount of water you need to intake per day, the general rule that a lot of individuals go by is the 8 times 8. 8 ounces of water, 8 cups a day. And that is a general rule that a lot of individuals will use. That, however, does not include the amount of ounces that you will need as you start to increase in your training. With that, again, just feel your body. If you start to feel thirsty throughout the day, then obviously you need to add more water and or more fluids. In general, it will not affect you if you overhydrate. Most people will just excrete it, so it's not something that you really have to be that concerned about. Now, with training, as you increase your mileage, you will also need to take water with you and or some type of hydration. Typically, After 45 minutes is when individuals like to increase their fluid intake during the run. The suggestion is typically 1 ounces to 3 ounces per every 45 minutes, and then after 45 minutes to increase it every 20 to 30 minutes, again from the 1 ounce to the 3 ounce. This is something that you will have to play with during your training, so you know how much and how often you'll need to hydrate during your race. The last topic I want to touch upon are supplements and how to use them effectively. The one thing I will say in regards to supplements is you need to experiment with the supplements as you go about your training. I don't care whether that's goos or gels, trail mix, or even pickle juice that are some of the types of supplements that are out there. You will need to make sure that you know the type of supplements you want and how much and how often you want to take them prior to race day. I do not recommend to add or change supplements on race day, as you will likely see a negative effect. So that's just a couple of the topics that I want to touch upon today. I hope to see you out there training.
Hi, I'm Chris Martini, the race director for the GE Appliances Kentucky Derby Festival Mini Marathon and Marathon. The Mini Marathon and Marathon is the largest day ever racing in Kentucky, and we are so excited for this day to return on April 30th of 2022. This year, we have several race options for you. The Mini Marathon, Marathon, and Relay in person, as well as a virtual Mini Marathon and Marathon for those who can't make it to Louisville. For this year's course, all runners will be beginning on Main Street near Slugger Field and get to run through all of Louisville's historic neighborhoods, through the infield of Churchill Downs, before finishing at Lynn Family Stadium, where marathoners will also have the opportunity to run in southern Indiana along the Ohio River. Our goal is to create a unique and memorable experience for all participants. If this is your first time running or just getting back into running, we hope you will take advantage of our training program offered by Norton Sports Health. And we can't wait to see you all at the finish line.
Thank you all so much for all of that great information. So I hope to see everyone tonight at the kickoff. In order to comply with CDC guidelines, we do ask that you arrive masked and during your assigned time slot, which was chosen when you registered for the training program online. Please plan to arrive at the Kentucky Derby Museum during your assigned time slot to pick up your training manual, your training shirt, if applicable, and chat with some of our very important guests. Our Norton physicians will be there, as well as court physical therapy, a sports nutritionist, swag sport shoes, and more. They can answer all of your questions before diving into this training journey with us. Again, thank you so much for your continued support of the Norton Sports Health Training Program for the KDF Mini and Marathon. I look forward to seeing you all tonight at the kickoff and this coming Saturday for our first training run of the year. See you there.